Welcome to Lifestyle Matters. I'm Marilyn Moore. Today we are at Fresno Surgical Hospital with Dr. Lee, who specializes in shoulder surgery. Doctor, welcome to the show.
Thank you very much for having me, Marilyn.
Now, I know the shoulder is a very intricate joint, very susceptible to injury.
That it is, and there's a lot of different injuries, and it definitely depends on your age, what kind of injury you have. So you can range from things when you're younger, when you have labral injuries, when you have instability episodes when you're younger playing sports, and as you get older or more mature, sometimes we call it that, you develop arthritis, things along those lines. So a lot of different things in between for the shoulder, a lot of different pathology that you see there.
And what kind of conditions do you treat?
So mostly rotator cuff issues, sometimes fractures around the clavicle or fractures around the shoulder I treat as well, but mostly focusing on arthritis. So shoulder arthritis is what I like to work on.
And how do you develop shoulder arthritis? How do you treat that?
Shoulder, that's a very good question. We actually don't have a very good answer as to why shoulder arthritis develops in people. And some people have no pain from it and their x-rays look terrible. And some people have a lot of pain and their x-rays are not quite as severe. So we don't quite know. We think it's mechanics or the way that the shoulder is used, just because there's so much range of motion with the shoulder. So different sports, you have golf, you have tennis, you have weightlifting activities, very different activities that you can do with the shoulder with a wide range of motion. So any changes in mechanics can oftentimes cause arthritis. And what we think that may be an issue as well.
And then how exactly are you treating it here?
So with shoulder arthritis, very different things depending on where the patient's at, depending on what stage they're at, how old they are, what their activity levels are. So something very simple as physical therapy, restructuring their mechanics, something very simple like that, going to injections to help with steroids, to help with the pain. And ultimately, there's different types of shoulder replacements if they ever get to that point as well to treat the shoulder arthritis.
And what's really your goal with the surgeries?
Goal with the surgery is better quality of life. So we want to make sure patients are able to do what they want to do with it. And if it means getting them back to their quilting activities, perfect, we'll be able to do that. If it means getting them back to playing golf, we'll be able to do that as well. So different activities that they want to do. So better quality of life and certainly pain control with that as well.
Are you seeing a positive outcome in the surgeries that you're doing?
Yeah, a lot of patients, they usually don't like me for about the first week or two after surgery. They're not very happy just because they hurt a lot. But long-term wise, they do very, very well with it. They're able to regain a better quality of life and their pain is relieved. And they say, wow, it is a little bit longer of a recovery, but they do very, very well with it. And they're able to gain their quality of life back.
So it really is worth it. And what about new technologies? What have you been using?
That's a very good question. And so we've adopted a lot of technology from the hip and the knee replacements. And a lot of technology, we use a lot of computer technology now. So we're actually able to scan your joint and figure out what implants would work and what range of motion you have with the implants prior to even doing the surgery itself. So you can plan for surgery. You can make patient-specific instrumentation, meaning if you have a very bad deformity, we can make a custom cutting jig or a custom guide to be able to help you or help me really with your deformity in your shoulder and give you a better outcome. And we can predict kind of what range of motion you're going to have with different implant sizes. So we can do all that now, which is great.
Absolutely. Now, why did you really pick, working on a shoulder?
It's a very good question. I love the mechanics of it. I think the anatomy is very interesting. And like I said before, there's a huge range of motion with it. And different patients with different pathologies. I just love the anatomy. I think it's great.
And when someone has a shoulder injury, it's not the end. If they have arthritis in there, they could come to you. You can really help them come up with a solution.
Mm-hmm. And certainly, the goal is better quality of life. And I usually tell my patients, you're the captain of the ship. You tell me how aggressive you want me to be. We can start off with something simple, or we can go all the way to replacing your shoulder, all different things that I can help with.
That's great. Now, what about working here at Fresno Surgical Hospital? Why do you really enjoy that?
It is such a wonderful place to be. You have such great staff. The facility is wonderful, really state-of-the-art technology, very accommodating people. So it is just a really, really nice place and to be able to work. And everyone's a team here, and everyone's familiar with what you do. So they know exactly how to take care of patients. They know exactly what to do with the slings that come out after surgery or how to take care of incisions. They do a fantastic job.
Sounds like it. And doctor, thank you so much for all of your time. I know I asked her a few questions about my shoulder because I had a shoulder injury and she already cleared everything up. It sounds good. I don't think I'm going to have surgery.
Hopefully not.
I hope so too. But what you said sounds great to me. Thank you again, doctor, and thank you, viewers, for tuning in. We have been talking with Dr. Lee, who specializes in shoulder surgery at Fresno Surgical Hospital. I'm Marilyn Moore, and you're watching Lifestyle Matters.